My name is Rachel, and I am a 28-year-old artist that presently lives in Manhattan. I have 3 often annoying brothers and 2 wonderful parents. I'm a graduate of Delphi University and have also completed my Master's of Arts in Web and Multimedia Design from Touro College. My journey has not only included the study of graphic art, web design, and photography, but also includes visits to more than 30 countries on 5 continents. My art is an expression of my heart and mind. I visualize my work as an artistic expression of whatever feeling, emotion, or objective that I am trying to achieve. In both my web and graphic design, I am trying to accomplish a given result based on the expectation of others using my own artistic expression and experience. With my photography, I am the 3rd generation of photographers following their footsteps into an ever-expanding world of artistic expression. In my photos, I search not for the obvious, but for the hidden emotion or tension that lies just beyond the surface. My goal is to capture the energy, movement, and passion that hides from view, yet is the basis of great art. Another aspect of me that generally hides from view is FD. I was born with familial dysautonomia, a rare genetic disease that affects the autonomic and sensory nervous systems. I have a difficult time with many automatic aspects of life that healthy people take for granted. Things such as balance, temperature, and blood pressure regulations, and the inability to feel pain. For example, when I was 2 years old, I broke my arm, and we didn't realize it until it turned different shades of purple. The purpose of the video is a multiple. 1, I want to educate people about disability in general and FD in particular. 2nd, I want to show you the amazing friends I have made and provide you insight into numerous ways people deal with our genetic disease. I hope you enjoy and benefit from my video.
I'm 21 years old. I go to Hunter College and I was diagnosed with familial dysautonomia at the age of 2.
I'm 37 years old. I have FD. I live in Boynton Beach, Florida. I've lived here for 6 years and a couple of months.
I live in Charlotte, North Carolina. I'm 20 years old. I have familial dysautonomia. I live with my parents and my sister. I go to my community college. I'm studying for web design.
I'm 18 years old. I am patient number 513 with familial dysautonomia. I am currently studying studying communications at Pace University in Pleasantville, commuting from home and going part-time.
I'm 24 years old. At Rutgers University, my major is psychology. I like playing video games. I like watching TV. I like using my laptop. I like hanging out with my friends.
I am 25 years old and I graduated from school in New Hampshire back in 2012, and right now I'm doing graphic design.
Familial dysautonomia is a very rare disorder. It's hereditary. It affects the autonomic and nervous systems. It causes abnormal development of those nerves, and as a result, it affects almost all the organs of the body. To give a few examples, the eyes, the heart affecting blood pressure, the kidneys.
FD, their bodies don't act the same as everybody else's. For instance, we have trouble walking, we can't produce tears, some people have trouble eating, some people don't drink. When people take things for granted. They don't think twice about it, but with FD, you have to double check to make sure you're doing it correctly.
FD is very rare. There are a little over 670 patients documented in our database, with about half of those being alive right now. And I would say about 100 to 150 or more in the tri-state area. I think the major symptoms of FD are related to blood pressure. So there's an inability to regulate blood pressure the way that someone without FD. So for example, when a person with FD is enjoying a very delicious meal that their mother or grandmother makes them, their blood pressure will increase. They may become kind of red and blotchy. And this would be, observed by other people around them, or they may even be aware of it. And that's an example of something that they enjoy, causing their blood pressure to increase. They lack the ability to keep that blood pressure steady, like someone without FD can. And then it can also happen in negative situations. When someone gets sick or has a pneumonia, that blood pressure can skyrocket, and due to release of hormones, the person feels very ill with terrible nausea, terrible retching or vomiting, high blood pressure, high heart rate, and maybe even other symptoms, which can be slightly different with each patient. Sweating, drooling, blotching, and even some personality changes are possible.
I guess it means persistence. What I mean by that is having this disorder, you might have shortcomings, things might be hard for you, but you just fight and never give up and try your hardest. And if you don't get something right, you try again.
Well, an FD crisis is basically when your blood pressure shoots up and you're shaking, nauseous, retching, you feel horrible, you're coughing, you have a headache. It's just awful. You're not yourself. You're in a funk, basically.
Not very frequently, typically. She maybe twice a year, usually when she's sick with a cold, a sore throat, something little can tip her into crisis. We've had a rough month with her this month. She's been in crisis in and out most of the month, and we really don't have a reason why, so it's been really complicated. And she has her annual visit at the center tomorrow, so we're going to discuss that. She comes up once a year to the Dysautonomia Center, where she gets almost like a physical for a person with FD. It's a full, complete workup of blood work, test. She's there typically 4 hours, and they just really check everything out. And that's the time when we would talk to the doctors about what we're having problems with. I'm still learning how to deal with it. I haven't really gotten to that point of how to deal with it. I just dig deep for a lot of strength, and I just try to plow through and focus on her and help her get over whatever hurdle she's experiencing.
Me by with my walking and my blood pressure, and when I get sick. Cause when I get sick, it takes me longer to get better than everyone else. This month, I was just sick for 2 weeks and better. Then I just got over from being sick again with crisis. Crisis really takes me down, I can be, sometimes I'm in crisis like for 1 or 2 days, but this time I was in crisis for like 6 days straight. And the walking is like really difficult for me. I can't walk long distances without getting tired. So I use my walker or a stroller.
FD affects me in a few ways. My balance is always not so great. I can't feel temperatures that well, like hot and cold. My blood pressure goes it's not stable. I don't have great tear production, and yeah, and like pain sensation, I don't have that good. I don't have really good pain sensation.
In a few ways, so it affects, well, obviously my blood pressure. It makes it difficult sometimes for me to walk around. You know, it needs to stabilize, so if I'm sitting for a while and then I get up, my blood pressure will drop, so then I have to sit back down, and eventually when it rises, I'm able to walk again. And also, you know, I don't feel pain as much as some other people, and I don't have tears.
It affects my ability to walk. It affects, like, I get 2 feedings during the day. Right before I go to sleep, my blood pressure's high. I take Clonidine, a pill, to help my blood pressure go lower.
So Rebecca was diagnosed the day before her first birthday. The first year of her life, Rebecca started just getting a lot of respiratory infections at 10 weeks of age. And then after that, about every 6 weeks or so, 6 to 8 weeks, she had another big respiratory infection that would land her in a hospital. And no one could figure out why this was. And she was checked out for many, many things. She was, you know, she was examined from head to toe. She was tested from head to toe. A lot of doctors were really confounded by her because she did reach a lot of developmental milestones on time. She sat up when she was supposed to at 6 months. She crawled at 8 months when she was supposed to. She pulled herself up to standing at 9 months. A lot of babies do those things. Those are normal things that would indicate that her neurological system was functioning properly, yet she just kept getting sick. So the doctors really didn't think that something neurological was going on with her, but they couldn't figure out what it was because they also ruled out anatomical problems with her swallowing, with other parts of her body. It took a long time to figure it out. And so we heard about familial dysautonomia and asked 6 doctors if it was possible that she could have a mild form of that, you know, because the information was pretty dire and pretty intense. The description of what familial dysautonomia was at the time didn't seem to be like Rebecca, except I said, what if there was such a thing as somebody who had a mild form of it? And 6 doctors told me there was no way it couldn't be possible, but that there was only one doctor in the world who would give me a definitive answer, and that was Felicia Axelrod at NYU. So we got an appointment with her the day before Rebecca's first birthday, and she's the one who made the definitive diagnosis. But she said at the time that Rebecca would have one of the most mild cases that had ever been seen at NYU, and that with a lot of intervention, she would grow up and lead a good life and do a lot of things that she wanted to do, but that possibly swallowing liquids would always be Rebecca's personal weak spot. Other people might have other areas in their bodies that are particularly their weak spot, but for Rebecca, swallowing thin liquids seemed to be her weak spot. So then we went 3 more months with doing feeding therapy and thickening up her bottles, and then she got another big whopping pneumonia 3 months after her diagnosis. She was then 15 months old, and that's when we put the feeding tube in, because at that point she had had about a dozen pneumonias, and we had to basically protect her lungs.
Meeting all of, you know, the other patients that have FD as well, everyone's so nice, and we're like we're good friends, and it's just great to have other people that know and understand what you're going through also.
FD impacted me in the last year by me having the need of surgery. My gastrostomy tube kept breaking because it was located near the ribs, my ribs, so the ribs kept putting a hole in it. So to make that better, they did a peg replacement, which means they moved the G-tube close away from the ribs.
Kind of. I mean, they all stuck together on the trip, which I thought was really special. I don't think there was, I mean, it's kind of funny to categorize it, and I never thought I would the first day of the trip. But like Rachel said to me when we, oh yeah, this is my FD crew. Like, they have a name, they embrace it.